Okay guys, so in this video we're going to go through a cervical spine soft tissue treatment technique. So Glenn, how would we go about that?
So really common, particularly again in your office workers on their mouse hand. Often they've got their hand up all day, not supporting the elbow. They tend to tighten up through the upper limb, and they tend to get a big restriction and tension in their scalenes and sternocleidomastoid muscles around the side of the neck. That can obviously increase tension around nerve roots and stuff like that, and can also restrict cervical range of motion. So really nice technique to try and release that and to give them a little bit of relief when that's their symptoms. We've got Ben on his back, nice starting position. You want to make sure obviously that his head isn't falling back into extension, so we can just change that position slightly. I'm going to use a little bit of oil for this. I use just a tiny little bit of oil to reduce friction. Obviously check your clients aren't allergic to that. And then I'm just going to hold Ben's cervical spine in that neutral position whilst I apply the technique around here. Now I'm going to be using mainly my thumb and the inside part of my grip here, and I'm going to start at the top and work my way down. Obviously here you're looking at symptoms as well. If you think there's more of a neural component, this can sometimes be provocative. But if we think it's a purely myogenic tension, then this is a really nice technique to initially loosen that off. Opens us up for a variety of other techniques as well, which we'll go through in other videos, but this is often my starting point when someone comes in with unilateral neck pain or work-related upper limb pain.
Yeah, so I think doing those soft tissue things can then lead into other things, like you said, potentially MWMs, METs, things where you're getting some movement involved. Often the soft tissue technique can actually make someone feel like they can move further, so you then get more out of the other techniques that you're going to use, basically.
I think even if your end goal is to do joint mobilisations of the cervical spine or even cervical manips, I always find it beneficial to release off the soft tissues first. If we're getting a little bit of release here, we can increase the range, so bring Ben more into lateral flexion, puts the muscles more in a stretch, and now I can work through that position as well. Often I'll progress that as I'm treating, so I'm putting the muscle under a little bit more tension, and then we'll go through some other techniques that we'll follow on from here in subsequent videos. So that's a really nice soft tissue release for cervical spine, primarily aimed at scalene sternocleidomastoid.
Hope you enjoyed the video, guys. If you did, then please give us a like and subscribe by clicking up here. Also, don't forget to go over to strengthphysio.com and check out our members area, which has basically got our full library of all of our videos. You can get there by going to strengthphysio.com/members. Hopefully I'll see you on the site, and I'll talk to you all soon.